Okay.
There we are. All right. So again, thank you for everyone that's on. I apologize. Typically these run a lot smoother, but yeah, as everyone knows, we've been trying to get new CAB members on for the last 4 years. The folks that are on are just on for the goodness of their hearts. Their terms are up, and so we do appreciate those that do come on. The first thing that I did want to go over was the annual approval of the legislative report in accordance with the Pennsylvania Cancer Control, Prevention, and Research Act, Public Law 664 of 2016. The draft 2020-2021 Cancer Prevention Control Annual Report was sent to the CAB members for review. Once they approve it, then we send it over to the Governor and General Assembly. It's also going through our internal approval process at the same time, with the hopes that it gets over to the legislators by the beginning of January. This report includes the amount of state funds that have been provided for cancer. It also gives a brief summary of the organizations that received the funding and the results achieved as a result of the grants. These basically are called our specials. The other funding is the $2.5 million that we get specifically for breast and cervical cancer screenings. And that money all goes towards patient services. There is no money that goes for, the money does not go to administrative or staffing or anything else. That is all for patient services. So Suzanne, did you have any questions about the draft annual legislative report?
Yes, but I can't type them fast enough. So I started, the first one was the executive summary. It lists the number of adults diagnosed with cancer and who died, but it doesn't say children, and they're part of our society as well. And since we're giving pediatric dollars, I think it's relevant. Number two, I got that one written, but not in detail. And then why are there questions next to the pediatric dollars?
Oh, so yes, so I sent to the CAB the draft, and we were waiting for the dollar amounts. So the dollar amounts that pediatric cancer gets is from, let me go through. It's from income tax returns, vehicle registration, driver's license, and identification card renewals. And so we were waiting to see what that dollar amount had been from the previous year. In the new report, I can send it to you. It is much less than it was last year. The amount that they received and are able to distribute this year is $407,027, 407,027 estimate, which is much less than last year.
I don't remember how much it was last year, but I think the COVID has messed everything up.
Mm-hmm.
Okay, so that's one question. And my big question is on the executive summary, the bullet points differ from institution to institution. And that's probably because they weren't given a comprehensive questionnaire from all those bullet points, which would be really useful. You could formulate a questionnaire from the various points, A, in the comprehensive cancer report in the grant, and B, I mean, like our specific aims and so on, and B, based on all the different bullet points that people used. Like, for example, University of Pittsburgh, UPMC, didn't talk about cancer genetics cases or patients, and that someone else did. And it's not like there isn't a whole section on cancer genetics led by Fong Mai at UPMC. So I think I consider those reports nice, but thoroughly incomplete. And maybe it's what they sent you because they didn't have a comprehensive list of questions. But based on that and the grant, there's no reason we can't give them a comprehensive list of questions, which the answers would look much more impressive.
So I can respond, and then maybe April can respond because she's the project officer on the 4 cancer institutes get that state funding amount, and then they tell us what they're going to do with the dollars. And so that's why the bullet points vary from institution to institution. It's based on what they said they're going to spend their money on, that specific money. I know there's other funding that goes towards a more comprehensive cancer, but this is specific to the money that they get. April,
right. This is a reporting. Yeah, this is a reporting requirement to the legislator based on what funding they provide. And we only can report on the funding that is specified. I think this year it's $300,000 each of what is covered under and funded and done with that $300,000 per institution, right? So there is other ways that we do collect information from our partners when needed. And, in the past, we had success stories in the past we had, and I know there's a transition with, what is going on right now with PACancerCoalition.org. So this would be outside the realm of the reporting, but I like your idea, Suzanne.
Thank you. But it doesn't say this is what was done last year with the funding at each of these institutes. I mean, it wasn't clear to me that wasn't just some sort of report of what each of the institutes did last year, which would be inadequate. You see what I mean? There's no specification as to what those bullet points represent. If I can't figure it out, no
right.
more.
Right.
I keep my mouth shut.
No, Suzanne, that's a very good point. I think we can just we need to be clearer about what we're reporting on in that report. I also like your idea about we can add the pediatric cancer numbers to the report. So we can circle back and see if we can add that to the report. I will tell you my strategy. These reports have looked different every year. The feeling is that in Pennsylvania, we don't get a lot of state funding for cancer. We get $2.5 million thanks to the PA Breast Cancer Coalition for continuing to go over there and advocate every year for that money for breast and cervical cancer screenings. And then we get a little bit of these 1.2 million to go to the cancer institutes. But there are other states that get tobacco settlement money that's reallocated to cancer, and there's other funds. The example I give is when Lyme disease gets 3 million and we're getting 2.5 million for breast, there's something wrong. So my strategy this time was to say, hey, these are the limited amount of dollars that our state legislators shoot over to us at the state level, and maybe to get them to think about, wow, maybe we need to start looking at how we're funding cancer. So that was sort of my strategy this year. We can definitely make it clear about the specific money, and maybe even say something. There are other things that they're doing through other funding that they have, worked very hard to get to do their comprehensive cancer. But yeah, let me think about how I could rewrite that, Suzanne. I appreciate that.
The limited funds, this from the state, this is what these institutes did with those particular funds.
That's
or something
perfect.
like that.
Becky, I'm not sure if you can see it, but Margaret is on, or Peg's on.
Oh, great. Okay. All right. Well, then let's go back if Peg is ready, and she can. We can go to the call to order, and we can officially start. Suzanne, do you have any other questions? I don't want to cut you off and then come back to this.
No, I'm good. Those were my questions. It
Okay,
seemed like
super.
a lot. I know I'm particular, but
No,
when I
I
get
think
off
it's very helpful.
the committee, you'll miss me.
Okay, well, and then we'll turn it back over. Thank you, Suzanne. We'll turn it to Peg to read the conflict of interest, and then we can get to the CAB business.
Sure. Thanks very much, and my apologies for the delay. I had some difficulties getting in. So just Act 33 clearly stipulates that the Pennsylvania Cancer Control Prevention and Research Advisory Board, the CAB, no member of the board shall participate in any discussion and decision to recommend grants or contracts to any association or to any agency of the Commonwealth or its political subdivision with which the member is associated as a member of the governing body or as an employee, or with which the member has entered into any contractual arrangements. Board members' affiliation listings are signed and dated before the start of each CAB meeting. To avoid any conflict of interest or adverse interest, the member of the board abstains from participating in all discussions and decisions regarding an issue of an RFA, RFP, grants or contracts, or discussion leading to a recommendation. To avoid even the appearance of conflict, the member should actually leave the room during the vote on any such proposal, and the minutes of the meeting should indicate the recusal of that member from the vote. So all the members have reviewed this in detail. They've completed their appropriate forms to discuss conflict of interest. I think we're good to go. Anyone else have any questions regarding this? Okay, and then also please note that this meeting will be recorded so that y'all can go back for future reference or send on to other colleagues as needed. Thank you very much. Appreciate the help and support.
Thank you, Peg. Appreciate it.
Yeah.
So yeah, I started with the annual legislative report. It was sent to the CAB members as a draft. Suzanne just provided some really great feedback. Look, I'm going to try to add. I'm going to add pediatric cancer incidence and mortality in the data in the first paragraph, and I'm going to be more specific in the information regarding the 4 cancer institutes, and I'll add some language around with the limited amount of funds allocated by legislators. This is some of the work. This is the work that was done with these small amount of dollars, or something a little bit more politically correct than that. But I think that's really good. And so based on that, would you be willing to approve the draft annual report? So, or I guess that's what I'm going to ask. Are you willing to approve the report with those additions to the report? And I'll need the CAB members to say yes, no, or if they need something else.
Well, we're not going to get a quorum even if everyone's on, right?
Correct.
Right.
Do you want, Beck, do you want to send it out electronically as well? I mean, we can say we're in agreement at this meeting, but I think sending it out as well to get a yes or no within a defined time frame is probably the easiest way for us to get this done.
I agree. And that way I'll include the revisions so you are approving what I said I would do. So
Perfect.
We'll do that.
Thank you.
Okay. The next one is the update on the cancer health disparities video. So if you recall, back in March and maybe even December, Dr. Aurelia Dominic had presented on the idea of creating, disseminating, and evaluating the impact of a video explaining the efforts of the CAB and PCC related to cancer health disparities. The goal was to raise awareness of and interest in the CAB and coalition, describe the magnitude of cancer health disparities, portray the experience of individuals and organizations affected by cancer, and then describe and enhance the efforts of the CAB and coalition to address disparities throughout Pennsylvania. A lot of work was done. There was a lot of gathering of estimated budgets and ideas and folks who could do the video. And we got some budgets, and then we realized that we really don't have any way to appropriately fund this exercise right now. And due to our limited budget and procurement rules within the department, we said we were unable to proceed with the video at this time, but that we would look at requesting some funding in the next 5-year grant cycle to possibly be able to fund something like this video. So I just wanted to tell you where they're at. I know folks had said they would be interested in contributing some funding, but again, our procurement rules do not permit that. And it got a little, our legal came back and weighed in and said, we really just can't do it this way. So we will look for funding through our next 5-year grant application to fund this type of activity. So I'm not
Great.
sure if CAB members had any questions about that.
No, is Dominic on the phone?
Do we know if she joined?
Yeah, I don't.
I don't.
I see
I don't
Pat's
think
up,
so.
but is it really on?
We
I
have
don't
two
see her.
people on the phone. Do we know who that is? Can you identify yourselves?
Hi, I'm
Brian
Carla Ann
Jones, Men's
Henry.
Health Work Group. I'm sorry. Go ahead.
Oh, thank you. I'm Carla Ann Henry. I'm with the the Colorectal Cancer Alliance, and I have been part of PACC since September. I'm on the Disparities subcommittee and the Men's Health Work Group,
Thank
and I'm
you.
located in Philadelphia. Thank you.
So can I ask if are there anyone on the line who is a CAB member? So we're looking for Suzanne or for Aurelia Dominic, and I think everyone else is on. Okay. Then I'll proceed. The next update was going to be on pediatric cancer. Oh, go ahead.
There was a question regarding the disparities video in the chat. Is there anything else available that could be shared, like, for instance, slides?
I'm not sure how to respond to that.
I don't think so.
Most of it was discussions. Aurelia did slides back in December or March for one of our meetings. I could put that out there. People are interested in what sort of the concept around it, but we didn't get any further. We didn't actually start the video. We didn't start any of the sort of information that potential patients were gonna. There was just more of still around brainstorming all the things that we wanted in the video. So I can go back and look and see if there's anything to share. If so, I would. We put it on the PA Cancer Coalition website.
Mm-hmm.
Thank you.
All right. Okay, good. All right. Thank you. I wanted to make sure I addressed that. The next part is around the pediatric cancer research. I did get a message this morning that Will Kramer, the new head of the Health Research Office, was sick, but I'm not sure if Penny Harris was able to jump on today. Okay, and she just sent me a text. She's not able to get on, so I will present their information. This is something also that the CAB would need to approve. Again, I can present it and then I'll send it out along with the annual report approval, but I'll give you, I'll present what they were gonna say today. So the Health Research Office receives Pediatric Cancer Research Fund contributions through income tax returns and vehicle registration, driver's license and identification card renewals, and that's in accordance with Act 39 of 2017 and Act 73 of 2018. The Secretary of Health is responsible for designating hospitals in Pennsylvania that are conducting pediatric cancer research who are eligible to receive the funding for the calendar year of 2022-23. The recommendation that the CAB would need to approve is to combine the funds and then divide the funds equally among the 6 pediatric cancer hospitals that had been identified. Those 6 hospitals are St. Christopher's Hospital for Children, Drexel University, Penn State Health Children's Hospital, Children's Hospital of Philadelphia, UPMC's Children's Hospital of Pittsburgh, the Janet Weiss Children's Hospital at Geisinger, and Lehigh Valley Health Network Riley Children's Hospital. Right now, the amount that they have collected is $407,027. So that comes to about $68,000 per hospital, which is not near as, I think they got over 100,000 last year. But what we need to do is would the CAB approve those 6 hospitals, and is there any discussion?
So I would ask if people could give a yay or nay I'm not seeing everybody here on the screen easily, but I would ask those to vote yay. If you could please vote now. Do you want us to actually put it into the comments section?
Yeah, that would be helpful. And this is
Okay.
just the CAB members that vote on this.
Right, so we'll just put it in chat with our names.
Perfect. Okay. All
Last
right.
year, and why, if you have any idea of the decline.
Someone else had mentioned, I think just with COVID and folks, there's just less contributions. Also, historically, we've seen that when there's more options to choose from for tax, for your income tax and for license renewals, it just feels like it's the same group of people who are making contributions. And so it ends up less is contributed to the fund because maybe someone who might have done, organ donation is now going to do pediatric cancer. I don't know the data behind it, but
Okay, I understand, and I thank you. I didn't really ask my question appropriately. I'm wondering if it's for the same time span. In other words, 12 months to 12 months, or, whatever the time period happened to be.
I don't know how to answer that question because this is not my program. I do know that when this first started in 2017 and 2018, there might have been 2 or 3 years of contributions that were then finally distributed because the process was created. So maybe that's why there was more. I think year to year, moving forward, they'll be able to get a better sense of how much they do get from year to year. It's a great question.
Thank you. If there is data on that, and certainly I don't need it now, and I do intend to vote, I would appreciate that information.
I'll reach out to them and ask if they have been collecting that, and if not, if they have intentions of doing that moving forward.
Yeah, it's just really year to year is what I'm looking for. And I appreciate your help with that. Thank you. Thank you, Becky.
You're welcome.
Becky, you have 3 yeses and Pat has not yet voted, so.
Yes.
Okay. Any other questions about that? Okay, well then we will move on, and good, we're still on time, so that's great. So we'll move on to I'm going to turn this over to the co-chairs of the Genetic Genomic Work Group. That would be Andrea Durst and Alana Ram and April Barry. So thank you.
So hello, everyone. Oh, okay. I was gonna say I could just share my slides if that's easier. All right. Just rearranging things on my screen here. Here we go. Okay. All right.
Excuse me, Andrea, you want to show your slides yourself? Because I have them up.
Yeah, is that okay?
Yeah, it's fine.
Okay.
I'm going to go ahead and stop sharing, and then you'll need to, okay. See if you can share.
Okay, you should be seeing them now.
You're good to go.
Great. So good morning, everyone. I'm Dr. Andrea Durst, and I am one of the co-chairs of the Cancer Genetics and Genomics Work Group. I'm going to be presenting this morning on behalf of the work group and my co-chair, Dr. Alana Ram, who is not able to be present this morning. And also thank you to April Barry for helping us to put all of this together. And so before I talk about some of our recent accomplishments and future projects, I just wanted to give everyone a reminder of the purpose of the Cancer Genetics and Genomics Work Group. And the work group really is, our purpose is to facilitate the implementation of cancer genetics and genomics activities for all Pennsylvanians, especially with a focus on accessibility and availability of services to underserved populations. And our work group is multidisciplinary. It's composed of healthcare providers and public health professionals across Pennsylvania, all dedicated to advancing the cancer genetics genomics goals recommended by the committee, all as with all of our PCC work groups by volunteers. And so I think it just makes the accomplishments even more significant. So what I'm mainly going to talk about today is our Cancer Genetics and Genomics Provider Toolkit, which has been in the works for quite some time and was, I keep saying recently, but I think now it's been multiple months that it's been published on the PA Cancer Coalition website. And this is just a screenshot of the front page of that. So it is available currently from the Cancer Coalition homepage. I'm not sure how long it will be staying on the homepage, but it will always be available on our work group specific page as well. Now that this is published, we do recognize there are a lot of links. I'm going to be showing you some examples from the toolkit here coming up. We know that these are going to need to be checked and updated on a regular basis, so the work group has already worked out a schedule where we'll be updating this toolkit at least twice a year. And right now we're really looking for increased distribution of the toolkit. We have gotten it out to many providers in the states and professional organizations. But if you are aware of a professional organization or a provider that might find this to be a helpful resource, please let us know, and you can contact April about that. The other thing that I wanted to point out is that the toolkit is really very provider focused. So what that means is that there are a lot of resources on there that contain, a lot of kind of very medical resources with a lot of medical terminology, maybe things that might not be completely understandable to someone from the general public. And for that reason, I'm going to be talking about, we're actually working on a complementary patient toolkit coming up here as well. So this is just our table of contents, and this kind of goes through, everything that's included in our toolkit. We focused on two main areas of hereditary cancer. So we focused on hereditary breast and ovarian cancer syndromes, as well as hereditary colon cancer syndromes, with our main focus being on Lynch syndrome, since those are the two most common hereditary cancer syndromes that people would be referred to a genetic service for. And we have a number of different subcategories that we have provided resources for, from, how to gain informed consent, if a provider might be doing genetic testing on their own, what family history tools are available out there for providers and for their patients to record their family history, which is an important part of cancer risk assessment. We have a summary of the currently available guidelines, as well as some information about other topics as well. So direct-to-consumer testing might come up on a frequent basis in the clinic. Somatic tumor testing, where they're testing the actual tumor for genetic mutations. And then also some information that might be helpful for the provider to pass on to their patients. So we have some patient advocacy organizations listed in there. Some general information that is patient-friendly about genetic counseling and genetic testing that providers can pass on to their patients, as well as some video resources. And then this is just an example of one of the pages from the toolkit. So as you can see here, each entry has a link that directly links to that entry, as well as a description of what is contained within that specific resource. So by looking through this toolkit, our hope is that providers can find the specific resource that is most applicable to what they're looking for by kind of looking at this snapshot and then being able to link to that resource directly to get more information. And as I mentioned, we are working on a complementary patient toolkit. We have this approximately halfway done. We had a really excellent student who worked on the colon cancer piece of this. And now the work group is coming together to finish this up and work on the hereditary breast and ovarian cancer piece of the patient toolkit. And we are hoping that we will see that product out relatively soon as well. It is going to be in a similar format to the provider toolkit. Now we are also looking at our website analytics for the number of hits that we get on the provider toolkit. And if we find that, from that information, there may be some better or additional way to get this information out to the public, I'm hoping that that information can help inform that and our future use actually of both of the tools, both the provider and the patient toolkit.
One of the things that we are going to ask your help with is dissemination, again, of the provider or of the patient toolkit when this becomes available. I think it's very key that we as a coalition share resources within our own systems with our healthcare professionals, as well as your partners that we are not partnered with, to get this information out to the public. So we'll be developing a dissemination plan. We're still disseminating the provider toolkit, but yes, so we're going to put a call for help out once it's available.
Yes. All right, and then just to end, I wanted to just give a summary of our other current projects for the work group. So one of the main projects that we're working on now is a needs assessment survey of specifically primary care providers in Pennsylvania. We hope to survey them electronically about a number of different topics, but mainly focusing on, what are their needs in regards to cancer genetic services and being able to refer patients appropriately. So looking at what they're currently doing right now, what are the barriers to referral for services? Are they, gathering family history, and to what extent? And what educational opportunities they might also want from the state and the work group. Our goal is for this survey to be distributed in early 2022, and we're hoping that it will also give us information to kind of be the basis of our next application for CDC funding for the cancer genetics and genomics. Every couple of years, they come out with a new call for proposals, and we're hoping to submit again when that comes out, I think, soon. We're also hoping to add to our specific PCC workgroup website. We've talked about a number of different things, but the first aspect of that the workgroup is going to be working on is our landing page news, so that there are some kind of more recent updates in cancer genetics that are on our front page when someone would come to that. We're also looking at developing some sort of Ask the Expert resource. We've tossed around a number of different ideas. We have formed subcommittees for each of these different projects. And so the subcommittee will ultimately decide what's done, but we've talked about maybe some sort of online question and answer format, an FAQ page, or even some sort of social media, like Ask Me Anything kind of event for cancer genetics. And then I just wanted to end by saying thank you to all of the members of the Cancer Genetics and Genomics Work Group who contributed to the provider toolkit, and to all of our new work group members who are not yet listed here on this slide, and that we're really looking forward to working with everyone across the state to roll these projects out over the next short period of time. And if you have any questions, I'm happy to answer them now. I know April's also on the call. You're also welcome to email myself or Alana or April at any time. Thank you.
I just want to say kudos. It's really excellent.
Yeah, this is really great. Thank you. Great presentation.
Yeah, beautiful job.
Any
Pat,
questions?
Pat actually had a question. I think, Pat, you're on mute. Still can't
I'm
hear you,
flicking
Pat.
my
There you go.
microphone.
We got you.
Okay, there we go. Okay, I think I was unmuted because I was trying to speak. I have two comments, questions for the doctor. First of all, that's a wonderful presentation. I look forward to reading all of it, and particularly seeing the next edition, the patient's toolkit. My first question is this. Have you looked into, or do you have any information on one of the barriers that we've come across, and I don't know if you have or not, for those people who want genetic testing, in this case, of course, for breast cancer, that sometimes their insurer pays, sometimes it doesn't. I know there's certain guidelines, but in general, it's very difficult for people to sign up to receive a medical service when they don't know if they're going to have to pay for it, if their insurer is going to cover it, or if they do have any obligation to pay for it. You know, what would it be? And I'm wondering, and then I have another question, what you have found in this regard, because it was like with mammograms, now we've got them free. Cost is a barrier.
Yeah, and so that's been an ongoing concern with genetic testing. I will say that, you know, now most insurance companies are paying for testing for people who do meet the established criteria, which continue to get expanded, I feel like, year after year, so encompassing more people as opposed to fewer people. So that's good news, but we know that some people are underinsured or don't have any insurance. There are, and really, you know, from my knowledge, varying by geographical area, sometimes an institution like funds to help people get testing. Some of the labs provide patient financial assistance for testing for people who maybe don't have insurance. So those are some potential avenues there. As far as, you know, people knowing what they are going to be paying ahead of time, I know that that's something, as a genetic counselor, when I was in the clinic, I talked with patients about regularly, but also not all patients are being seen through a genetic counselor anymore. And so from my understanding, there were programs through the labs themselves where they would notify the patient if they would have an out-of-pocket expense greater than a certain amount. Now, I've been out of the clinic for a little bit now, so I don't know if those programs are still in place. There might be a genetic counselor on the call who is currently in the clinic who might be able to speak to that better.
Well,
So
may I
Andrea,
suggest, I'm sorry.
I'm
May
sorry,
I
this is, I can interject for a second there. Sure, there are programs that would help with covering for the cost of testing. But sort of going back to past questions earlier about patients being reluctant to come in, I mean, I think that's the first barrier, right? If they don't know what's going to happen, they might not even make it to the clinic to see us for us to get all of that sorted out for them. And so I wonder, I mean, it is true. I mean, I wonder if there's a way that we could incorporate some of that information in the materials that we have available. But you're right, Andrea, there are those programs, and for the most part, if they're uninsured, or if they are under the poverty line, we can probably get the testing covered, but then again, we can't get the visit covered. So how are they going to get that done even before we can draw their blood? And I think that one of the barriers that we probably need to address a little better.
So I don't know.
Interesting, actually,
I
to
would
address that.
strongly suggest that, at least in the patient toolkit, that you have a significant component on how people can access the tests from an insurance and a financial point of view, because it's a major barrier. And I'm aware that some of the labs only charge $250. But it's such a labyrinth that it's hard for people who even work in the field to understand it, let alone a patient who's worried about, what her obligation might be if she starts down this path. So I would hope that the patient's toolkit will address this issue. And my second item is on the communication and the rollout. The Pennsylvania Breast Cancer Coalition we have about 86,000 people who are involved in breast cancer, either as patients, survivors, families, etc. And we will certainly love to work with you about getting that to those 86,000, that information to those 86,000 people. The provider portion of it probably doesn't speak to the average person, nor should it. I understand that. That's specifically a provider thing. But we do have a lot of doctors, nurses, radio techs, a whole lot of professional people, providers as well. But once the patient kit is available, I think we can publicize that on a repeated basis, possibly do a workshop on that at our conference next year. And we keep our conference online on our website for a long time after the conference. And we also give free nursing credits to those who take any particular workshop. So that's another way to reach nurses at least. So they're my two thoughts, that the cost issue from a patient perspective needs to be addressed up front. Rich people can afford it. Rich people can take the chance. Average people, we have a woman who just got a bill for over $4,000 for an MRI. Now we have legislation, which we got passed, that will cover that, but it doesn't go fully into effect until 2022. So she got a $4,000 some odd dollar bill and is going to be paying for God knows how long on that. And that's what happens to people. She had family history. She certainly have an MRI. And there she is, that family is saddled with $4,000 plus interest. So I salute you and I congratulate you on the work that you're doing. We'd like to partner with you. I noticed that on your list of participants work with you, you have one of our board members, Dr. Susan Domchek, and we work very closely with her on this as well.
So I have a question and a comment. I don't, you might have, anecdotally, I'm aware that a lot of people of color or some of our target populations, even when going through a cancer process, not just with breast cancer, most people anecdotally get asked questions about whether they're HER2 positive or negative, like people know that. But when it comes to some of the other cancers in the genetic piece, most people who are disparate in other areas don't get it. So I'm wondering what kind of things do you think could happen or needs to happen for even the provider that first, like when you go in and you get after your diagnosis and you're seeing the oncologist, you're seeing the radiologist, you're seeing all of these people, but most people never even hear that this is available and why it's important. So from a perspective of communicating and on the PCC, and I know we do that, it makes me think about what kinds of information do we need to get to specifically to some of our populations of focus, but in general, and what can we do for the clinical base to help elevate not just using Toolkit, but some of the strategies that they might need to employ, because their thing is always the same, a very busy practice with all of these things that they must do. Here's another thing we need to add. How do we educate our clinical base? I hope that makes sense.
It does, and it's, you know, it's a pretty common issue that we come across, is that people don't pursue genetic testing or come to genetic services because no one told them that they needed to. And so that's really a huge focus in public health genetics from the level of the CDC down, is how do we do better at identifying people who are at risk for having these hereditary cancer syndromes. And so you're asking the right questions, and I think that's what really ultimately is what this work group is trying to work toward with all of our projects. So we hope that, right, by putting the resources out there, that it will be easier for providers to find that information. And then hopefully we'll find out more from our needs assessment as to specifically what would be helpful for providers. But it's a big concern, and it's led to many people who are at risk for these conditions not being identified.
So Andrea, were we talking about putting public service announcements on social media and on television once and radio once the patient toolkit is available?
I don't know that we talked about public service announcements specifically for that, but that could certainly be something to consider. I know we talked about them for something in the past, but I don't think it's been since the dissemination of the toolkit.
Right. And one of the things that we need to then look at is the funding for undertaking a project like that. So that's something, you know, I know Andrea, we're going to talk after the meeting or sometime today about the new funding opportunity that you found, and you're working within your within the University of Pittsburgh as part of the CRC work group. So maybe those are some of the things when we can develop outside funding and resources to get PSAs out. And there's some PSAs already developed by CDC that we don't necessarily need to utilize money. And that's one of the things that I think we, you know, work smarter of looking and doing a survey of what are the resources of PSAs that are out there for genetic and genomics counseling.
Yeah. Yes, and April and Andrea, I might suggest social media. We're in the midst of a Don't Miss Your Mammogram campaign to reach those women who usually get their mammograms, but missed it during the year of COVID. And we have a PSA and various things like that. But we put it out on our social media, and much to my shock, it reached 1.3 million people. And I thought our community, you know, our social media staff person was kidding me. I said, oh, come on. No, really, what was it? She said, no, we have the data. We have an outside firm that monitors it. It reached 1.3 million people. Don't miss your mammogram. So, and it costs, I don't know, $1.98 compared to anything else. You know what I mean? It's very inexpensive. It's peanuts compared to any other kind of outreach. So I would suggest exploring that. I can't be helpful because I can barely get on these, these kind of meetings without trying twice. But I'm sure you have those resources in the department, or Natalie, I'm sure would be happy to chat with somebody about it. And it kind of bypasses the money thing.
Yeah, it does. And I think I want to kind of echo that, but from a different perspective. I think we really need to begin to think outside the box with what we already have. We don't have money, but what we do have, this meeting right here is being recorded. So not just for genetic testing, but for all of our things, maybe we can start thinking about doing 10 to 15 minute short snippets that we plan for, that we script for, and that we use what we have already to put something out there. Just a thought, and I won't take up, I know we've had a lot of discussion, I won't take up much more time, but consider that. Again, it's the time commitment for all of us, but that's something we can think about.
Very good.
All right, I think if there's no other comments, thank you so much for the presentation. This is really great work. Thank you for everyone involved. I'll turn it over to Peg to close out the CAB portion. And then I think if we just take a 5-minute break, we can start the PCC meeting, if you guys are okay with that.
Sounds
Yeah.
good.
I truly appreciate everybody taking the time and investing in the education. I think the project and the program that we discussed today is the perfect example and blend of clinical expertise and dissemination to the community. And that's exactly what CAB's about. So, as well as the Pennsylvania Cancer Coalition. So I do want people to disseminate. Your job here is to take all of these wonderful tools, think about who could really use them, and get that information to the team so that they can appropriately get it in the hands of people who will benefit. So thank you for your time today, greatly appreciated, and we'll take our 5-minute break.
So that should get us back here at about 9:35 to start the PCC portion of the meeting. A few more. Well, we're at 9:35 right now, so welcome back, everybody, and welcome to the PCC portion of the meeting. And I think we're ready to get started. Monica, if you will share the screen, please. First of all, can we go back one? On behalf of Casey and myself, we want to welcome everybody, and I want to make sure everyone's aware that Casey Monroe from Adagio Health is the new co-chair of the PCC. So once again, we want to welcome her. So welcome, Casey, and we'll move forward now with the agenda. Next slide, please. Okay, next on our agenda is actually the midterm cancer plan report card that Heather Batson is going to present, and possibly members of her team. Heather, you have.
Hi, good morning. So we're presenting both some findings from the evaluation report focused on the survey that we all did in May and June. And then Isabel will present the report card progress on the Pennsylvania cancer goals. So I'm going to share my screen for my section now. And my apologies for not being on camera. My internet's having a little bit of a struggle today. And so I want to make sure that the slides work well rather than you seeing me talking. Okay, so I'm going to present some kind of big picture findings from the member satisfaction survey and some possible opportunities for continuous quality improvement. There's really a lot in the survey, and if you're interested, we can share the full survey findings with anybody that wants more detail. But just to keep it kind of big picture, first I'm going to address the data sources. So this is mostly based on the member satisfaction survey. This was done in May to June 2021. We had a multi-pronged campaign to try to get as many PCC members to fill it out as possible. And we also discussed some of the membership data here. And Isabel will be following with the report card presentation. One of the findings is actually a meta finding, which is about the survey participation. In the past years, participation in the annual survey was pretty low, between 30 and 47 people, which was okay when the PCC was relatively small, but now there's about 300 people. So 40 out of 300 people is not great representation. So we, with everybody's help here, had a big push to try to increase representation and in the survey, and we used a multi-pronged strategy, and it was very successful. It almost tripled participation. So here's a graph that just shows over time for the past 3 years what the annual survey participation has been like. It dipped a little in the 2019 to 20 pandemic weirdness time, and then this year 112 members participated. So these members were asked about the benefits and barriers, their attitudes about participation, and COVID impacts on their work towards Pennsylvania cancer goals. We also asked participants who said that they were active members of the PCC, and that meant that they attended at least one meeting in the past year or were actively involved in a work group or subcommittee, the 9 habits questions about PCC functioning. The 9 habits are a framework that the CDC and partners have produced to help cancer coalitions address their functioning and look at functioning in different ways. So I do want to say that I'm about to present a bunch of things that look at responses over time, and I want to say that we need to be a little bit cautious when we look over time, because we have such a larger number of people participating that in the past we kind of had a group that were responding that were either the super dedicated folks and then just people that will do, they're survey doers, like they're compliant in that survey doing way. And in survey methodology, we know that that's kind of a profile that exists, and those people sometimes can bias results because you can imagine that someone that is always dutiful about doing a survey that comes across their path might have other features in common as well. But I'm first going to address some past challenges and then talk about what is new. So one of the past challenges that we have been tracking over time are some issues with communication. So in previous years, communication was identified as an area with some room for growth. And last year, we saw some improvements over the previous year. So we're very interested to see if they were sustained in this larger sample of members. And so here are the 4 questions that are focused on communication and their arc over the past 3 years. So the first one is about the overall coalition members, coalition communication, and it went up from 69 to 75% between the 2018-19 and 2019-20 year, and then it came back down a little. And the PCC meetings are effective. We work on activities related to cancer plan implementation was fairly steady, especially given this profile of like way more people are answering. We saw the next 2 items are related to work groups and subcommittees. And so work group subcommittee communication was in the high 50% of agreement at the 2018-19 survey year, and then went drastically up in 2019 to 20, and was mostly sustained or increased a little more in 2020 to 2021. So we think that in general, satisfaction with communication is pretty high overall, and previous perceived improvements were mostly maintained, even with the much larger sample. We were a little concerned that we would see big decreases because there could be bias in the folks who are receiving communication being more likely to do the survey with the smaller sample. But it seems to be mostly maintained with the larger sample. The workgroup and subcommittee communication went from lagging behind the overall communication to being ahead of it. So that says to us that it looks like the work groups and subcommittees are doing really well with communicating. And we are aware that some work groups and subcommittees had some challenges in the 20 to 21 fiscal year, but these improvements were mostly maintained. So that is great. So work groups and subcommittees, like, keep doing what you're doing and engaging members the way that you are. We're very aware also that there are some communication initiatives that have been launched since the survey was administered. So there's now a weekly newsletter. There's more regular work group subcommittee reporting at PCC meetings. There's some enhanced collection and posting of subcommittee notes. These are all underway, and they'll hopefully improve communication even more. I also wanted to mention that communication in a large coalition is kind of a perennial problem that does require constant, like, rebalancing. So it's not really, the communication is pretty good, and it's kind of a thing that you always have to watch for with coalitions. So the challenge number 2 that we wanted to keep an eye on is representation on the PCC. So in the past, participants perceive some areas where the PCC might benefit from more representation. Members and leaders have been working on this. So are we seeing changes in the perception? So PCC representation has been a concern for this entire grant cycle, and our item that we've asked people has remained the same since the 2017-18 survey. So that was a prompt that people were asked to agree or disagree with about the membership of the PCC is diverse and represents all sectors of the community. So some improvement in member perceptions have been observed from the 2020 low. There has been quite a lot of variability over time. And one of the reasons for this, we think, is that the question is pretty broad, which allows a lot of interpretations. And we can get some clues about how people are interpreting it with the follow-up question, which is about where more representation is needed. And in the earlier surveys, the responses to that were more about what kinds of different professionals are needed or community members in general. And there were some responses always that have been about specific underserved communities or underrepresented communities, but that went up. Those mentions went up a lot in the 2019 to 2020 survey, which was completed in the summer of 2020. And we're thinking that some PCC members may have had awareness raised of racial justice issues who weren't paying as much attention to those issues previously, and that's part of why we saw that big dip in 2020. There's been slight improvement, but not a lot since then, and that may be due to the larger proportion of people that answered. However, many work groups and subcommittees have been working hard to address these representation issues in their membership, but there's still some room for growth. And we did ask that follow-up question. And so here is a list of the responses to what parts of the community should be better represented. So these blocks are roughly the size of how often they were mentioned. So people of color, communities of color, BIPOC, racial and ethnic minorities, Black members, Black men, those were all mentioned many times by many members. Survivors and patients, men, and community groups that are not necessarily health focused were also mentioned very frequently. Rural communities, LGBTQ or LGBTQIA individuals, older adults, disabled community members were also mentioned quite a few times. Allied health team members were mentioned by a couple people, and religious communities, conservative community members, and payers were also mentioned, but fewer times. One area of success that we're able to track is that we did see more survivors and family members answer the survey this year. So we asked the question, we're interested in knowing more about our members' personal experiences in addition to their professional role in cancer prevention. And so these are N's rather than percentages, but previously we had 22 close friends or family members respond, and this year we had 46 people who were close friends or family members. We had 3 cancer survivors respond last year, and now there are 12. And in both groups, about a quarter of the new responses are really from new members. So it looks like there really has been some success in getting new survivors and family members with that perspective to join. We're unfortunately not able to track accurately whether demographic and geographic aspects of membership are improving, partly because although we do have a new member form that includes some of that information, not everyone in the PCC has filled it out, and not all new members in the past year had filled it out. So we had really limited data and weren't really able to say much about that. So it is under consideration to ask everyone to complete a membership form annually or at some other time frame to have some better information about it. And as I mentioned before, many leaders and members have been working hard to recruit representatives from groups that were identified as underrepresented last year and this year. And so takeaway is that the PCC has succeeded in increasing representation from survivors and possibly other community members, although limited data about membership is available, so we can't report out on that specifically. We do think that the PCC should continue to recruit more members from underrepresented communities and communities with a disproportionate cancer burden, especially but not limited to Pennsylvanians of color. And to be most effective, the new members should be provided with clear orientation to their roles, including mentoring as appropriate, which leads us into a third thing that we have been keeping an eye on, which is role clarity. So role clarity of Department of Health staff, PCC members, and onboarding have all been areas that are related to each other that have some room for growth in the past, and these are also perennial issues for coalitions. So here we have, again, over time, for the past 3 years, where these are going. So new members of the PCC are oriented to their role. You can see there's a definite upward trajectory, but it's still a little bit lower than we might like. One interesting finding is that the newest members either had a strongly agree that they were oriented to their role or a few strongly disagree. And so we think that there may be some people who kind of slipped into a work group or subcommittee and didn't really officially join and get the onboarding experience that they were supposed to. So if you happen to know of anybody in your work group or subcommittee that maybe didn't get officially referred to the Department of Health staff to get the onboarding, then please make sure that you do that and they get that. Second, individual PCC work groups and subcommittees understand their expectation. Over the past several years, there's been a huge increase in this as well. Less rosy is the roles and responsibilities of PCC members and PADOH staff. These are both kind of hovering in the high 50s, 60s area without clear improvement. Even though folks have been working really hard to try to make roles and responsibilities more clear. So we have a couple takeaways for this as well. So initiatives to improve onboarding have yielded clear improvement, but there's still a little room for improvement. Procedure improvements have continued, and there's a new online onboarding toolkit to help with this. So we're hoping that next time we do this, we'll see even more improvement. PCC work group and subcommittee role clarity greatly improved, which appears to be linked to initiatives where groups formally discuss and report goals and processes and then follow those. So this should definitely continue. Role clarity in general is often a big challenge in large coalitions, and it is a challenge for us, like it often is. There wasn't a clear improvement in clarity over time, despite some attempts to improve clarity. This is probably related to a combination of some past onboarding challenges, the chaos of COVID, some staff changes, and possibly other factors in the mix. So one thing that we thought might improve this is an FAQ or quick reference for ongoing members that kind of mirror some of the information in the onboarding toolkit might be helpful for that as well. And so finally, what's new? So one thing that's really interesting is that most of the responses to the survey were surprisingly stable, even though there was a much larger sample than in the past. Most responses about PCC functioning were largely positive, with 70 or 80% agreeing or strongly agreeing that the functioning was going well and similar to past years in that way. The top perceived benefits of PCC participation were also very similar to last year, and most participants, like upwards of 80%, agreed that they were important benefits. So for example, the top two were developing professional networks and developing collaborative relationships and opportunities. The top perceived barriers were also very similar to last year and also very rarely endorsed. So only 12%, these are the top two, felt that I do not feel like we get anything done, or there's a lack of momentum, or my time and skills are not well used. One thing that is a new finding is the substantial impact of COVID-19 pandemic across the cancer control continuum. So we asked everybody whether COVID-19 pandemic affected their work on Pennsylvania Cancer Plan goals and any of the aspects of the cancer continuum. And so these are, of the folks that answered about prevention, 32% said yes, 36% said yes to detection and screening, 14% of those involved in diagnosis and treatment said yes, and 10% of those involved in survivorship said yes. And then of those who said yes, the top COVID impacts on prevention activities were that cancer prevention education programs aren't reaching enough people or the right people. Cancer prevention education programs are short-staffed or not able to function normally, and fewer patients are getting preventive care at all. So they're just not coming in. And so when asked to what these can be attributed, the respondents said that staff jobs shifting to COVID screening and vaccination had a really big impact on their ability to provide education and prevention, and that patients are reluctant to come into primary care or to screening events because of COVID fear. Similarly, with screening and detection, the top items were that fewer patients are screened at in-person routine physicals, screening tests and procedures are delayed due to increased delays in seeking care on the patient end, and also that screening tests or procedures are delayed due to provider capacity or other medical systems issues. Many comments suggested that colonoscopy is maybe the most affected screening for this, but some other screenings were also mentioned. Some respondents reported temporary interruptions that are now back to normal, but others reported screenings have been slow to return to pre-pandemic levels. And there's also common comments about patient fear and some ongoing fear of coming to medical settings for screenings. The diagnosis and survivorship impacts reported were much more qualitative and more widespread. So there were increased delays in diagnosis, increased non-medical, non-cost barriers to treatment, increased delays in starting cancer treatment, treatment being reserved for most serious cases due to capacity issues, increased out-of-pocket costs and insurance-related barriers, and also improved access to additional specialists once treatment had started. The survivorship, of course, decreased access to in-person wellness programs, but decreased access to survivorship therapy and peer support in person, and increased delay in access to survivorship-related prevention monitoring, palliative, and other care, but also improved access to survivorship wellness through telemedicine. So the takeaways here are that in FY 2020 to 21, the COVID pandemic had a really big negative impact across the cancer continuum, and we're likely going to be observing the results of that for years to come. There were some unexpected increases in services reported thanks to telemedicine and virtual support, but overwhelmingly barriers to care increased for a wide variety of reasons, some on the patient side, some on the system side. And some barriers have eased, but others persist or could recur if or when hospitals get overwhelmed again this winter or in the future. So with the big picture overall, the increased response rate increased our confidence in the survey findings. So we'd love to see that increase even more this year. We do have concerns about representation on the PCC that persist, especially a need for members and leaders of color. Many initiatives have been implemented to try to improve PCC functioning, and we are seeing some positive effects from those, so that is great. And communication and role clarity are persistent challenges, which is normal for really large coalitions. So there are some initiatives to try to continuously improve that. One example is the weekly newsletter, and there's also more communication innovation coming. And there's also more great resources like the Genetics and Genomics Toolkit that are going to help with having something great to communicate. So that's what I have for my section. If we can jump to Isabel and then maybe take a couple questions. I'm sorry, we're a little bit over so far.
Possibly wrap it up like no later than 10:10.
Okay, yeah, definitely.
Schedule. But yep, this is great. Thank you.
I'm going to stop sharing my screen. Okay, thanks. And now Isabel can take it away and walk us through the report card.
Isabel, would
Heather.
you like me to put up the slides or are you going to share your own?
I was just going to share my own screen so I can walk
Okay.
through the report card.
Okay, great. All right.
Okay, so we should be seeing the PCC's site right now. Hi, everyone. I'll turn on my camera. My name is Isabel Rocca, and I work with Heather Batson and Connor Millard as the evaluation team for the PCC. And one of the things that we do as the evaluators is to create and maintain a dashboard to show the goal progress toward the state cancer plan goals. And previously, this report card was on Power BI, but that just wasn't fitting our needs. So this year we moved it on to PowerPoint, and I tried to make it as interactive as possible, and I'm going to share that now. So you can access this report card from the PCC's website under the Cancer and PA page. And if you go down, it is the Cancer Control Plan. So this is what you'll see when you click on that. It's a presentation. All of these colorful squares are interactive. So if you wanted to jump to the goals under prevention through healthy behaviors, you would click and it brings you to those set of goals. You can also just scroll through to see all of the goals and the whole presentation. There's also an overview page that gives you a snapshot of all of the goals and where we are in their goal progress right now, or their current status. So I'll share that goals that have met their target are represented with this little checkbox icon. Goals that are currently in progress are represented by this circle, and goals that have a data point that has slipped below the baseline value are marked with needs attention. So I will next show you what these measures look like on the graphs, but I also just wanted to share that if you click any of these symbols, it will take you directly to that goals page. So if I click here, it will again take me right to where goal, for instance, 3.1 is. So to read these graphs, the triangle symbol shows the baseline value of each goal, and then the direction of the triangle shows which direction progress is being made. So the small line icon here also shows the target value. So when this thick dark column reaches the small line up here, that means that the target value has been reached. So you'll see that goal 3.1 is in progress, marked by this symbol, and also because this column is between the triangle and the target line. Goal 4.1 is also in progress, but as you can see, progress is made by decreasing for this goal. So the triangle is pointing down and the target line is at 15%. So we have almost reached our target for decreasing the percent of current adult smokers. This goal, you can see, has been far surpassed. It has far surpassed its target, so it's completely filled up the entire chart. But once it reached, this line, that means that it was met. And then goal 5.1 is a needs attention goal because the current value has gone below the baseline value. So that is pretty much how to read these graphs. I definitely invite you to go on the PCC website and click around to see all of the goals and graphs yourself. I'm going to just highlight a few of the goals that have been achieved this past year or in previous years, and also some of the goals that need attention. So I'm going to start with goal 1.1, and that is increase the percentage of Pennsylvanians with a regular healthcare provider by 1.5 percentage points. Unfortunately, this is there's only a couple goals that have fallen below the baseline value, but this is a goal that needs attention. I think, we can attribute this to, healthcare costs have been rising steadily since the 2000s, and the average out-of-pocket cost has risen, and more primary care visits are being subjected to a deductible. And preventative checkups increased after the passage of the Affordable Care Act because many preventative visits were fully covered. And that's around the time that we set this baseline value. So since then, however, the number of people seeking preventative care has decreased. So we were at a bit of a peak when we made this goal, and now we are unfortunately dipping back. So that is just a goal that needs attention in our own state. Next, I want to talk about this goal. So this goal was increase the number of radon-positive homes with an operational radon mitigation system and increase that by 5%. So this goal was far exceeded. We set the goal at 13,306, and the current number of homes with an operational radon mitigation system has jumped up to 36,880. So we know that the DEP and the American Lung Association work group members are continuing to educate tobacco contractors and other tobacco service providers to ensure that information about radon and testing continues to be included into their work. And the Penny Health Equity Tour has distributed 600 radon kits that they received from the Department of Environmental Protection. PA residents have been receptive to the radon education and awareness message, and people are increasingly interested in testing their homes. And this year, they also requested 200 more kits to give out during future stops. We're also going to talk about goal 5.1, and that is increase the percent of melanomas diagnosed at an early stage by 3%. I unfortunately don't have too much information about this, but it is just one of the goals that, has dipped below the baseline measure, so we want to pay special attention to it in future years. Next, increase the percent of women who have had a mammogram in the past 2 years. This is a goal that has been achieved, and probably largely due to the breast and cervical early detection program work. Goal 9.1 has also been achieved, increase the percentage of women aged 21 through 65 who have had a PAP test in the past 3 years. Again, that is largely due to breast and cervical early detection program work. Goal 10 on this page has also been achieved. Increase the percentage of Pennsylvanians aged 50 through 75 who received one of the recommended colorectal cancer screenings per USPSTF guidelines by 6%. So this goal was also achieved. There's been a big ongoing push to increase colorectal cancer screenings, and this push involved multiple sectors, including patient navigation, which is targeting populations with barriers to screenings, and also getting FIT tests to the federally qualified health centers, where people with a positive FIT test are followed up with and moved through to the next steps of the screening process. In this time period, we also had the National 80% by 2018 initiative, where organizations of all types, including medical organizations, academic institutions, survivor groups, government agencies, cancer coalitions, and others committed to the shared goal of 80% of adults over the age of 50 being screened for colorectal cancer by 2018. And the initiative just obviously has been very effective, and we're seeing positive results here in Pennsylvania. Another goal that has been achieved is goal 11, which is increase the percent of lung cancers diagnosed at an early stage by 5%. This, is also can be attributed to work within our lung group, the lung cancer prevention group. And this summer, we saw a presentation from Dr. Ronald Myers from Thomas Jefferson University, and he presented on engaging a learning community to achieve the promise of lung cancer screening. So we have seen a presentation that is very relevant to this achievement. Lastly, we just wanted to point out goal 12, which also is one of the very few that have dipped below the baseline measure. And this goal is also connected to having, a trusted primary care provider, which is the other goal that we saw dipped below goal 1. And prostate cancer screening is really complicated, and informed decision-making is the best practice. The provider needs to have discussions about what type of screening a patient should get and what the screening and test results mean. And unobserved disparities between groups is something that the Disparities Subcommittee is looking at, specific to diagnosing prostate cancer. So that is what we wanted to share from the report card, just a quick snapshot. And if you have any questions about the report card or the data, I have my email address on the home page of the report card, so please feel free to reach out.
Isabel, there is a question regarding the clarification of the dark gray, light gray, and the white color backgrounds for the vertical bars. What is the difference?
Okay, so this was just to, I can reshare. So the dark gray, light gray, and lightest gray were kind of just to help visualize what stage or what, where the progress was. So in this dark gray bar, the dark gray is always going to be below the baseline value. This middle gray is going to be between the baseline value and the target value. And anything in light gray means that the target has been achieved.
Thank you. Any other questions? We have another minute or two, but then we need to move on. This is just great. All of this has been tremendous, in my opinion. Well, if no other questions, you know how to reach Heather and Isabel. And Brenda says this update is going to be really helpful to update and inform action plans moving forward. And I think we can all agree with that. Thank you again so much. So now we are actually ready to move on to our work group and subcommittee report outs. And we're going to proceed in doing that. No slides, just briefly talking on, and I think Monica, I did provide a little bit of an agenda on what is to be reported out. I know I said it in my email. Is there another slide there? Okay, I guess. Okay, so anyways, what I had updated these, but I think we might have gotten a little bit confused in the transition. But what we would like to do is each of the groups to report out, but mainly you did it last time, and I don't want it to continuously be the same, but maybe there is something this time that in your last 3 months you've been struggling with, or that you've achieved that you hadn't achieved prior, or something you'd like to bring to everyone's attention, and maybe a goal or two that you are looking forward to working on in the next year. So we'll start with the HPV work group.
Thank you. Can you hear me?
Sure.
Great. This is William Calla from Penn State. I'm the co-leader of the HPV work group. My co-lead is Pam Shower from ACS, who's also here on the call. So I will start with some of our ongoing or new strategies from the past 3 months. I want to mention that the Pennsylvania Action Coalition and the Pennsylvania AAP chapter, they launched a statewide campaign, not only for HPV vaccine, but all immunizations. And they have been doing this through local resources, including local newspapers and billboards. And this is quite important to reach out those populations that are sometimes hard to reach, that are not used to multimedia or interactive information. Another thing that they're doing, and we're doing very well with our membership, is to keep everyone aware about the local resources or national opportunities they have, including webinars, networking events, and toolkits. We're sharing with our membership weekly newsletters and any events that they can join. Most of these are at no cost, so many of us have been benefiting from that. Another thing, in the past 3 months, Christina Verdun from Temple University just finished the dental HPV model in partnership with the DOH, and this will focus on educating dental students on HPV vaccination as cancer prevention. A third thing that I want to mention is with one of my training programs that I have been offering for the past 4 months. It's called HPV Echo. You have heard about that. We just finished our first cohort. We offer training to 6 clinics, including 27 providers, not only physicians, but nurses, MAs, PAs, here in central Pennsylvania. With great success, we plan to launch our second cohort in April 2022, running from April to June. We plan to recruit 15 primary care clinics across the whole state. So we're offering free or no cost CMEs, 25 points for MOCs, and new this time, we're going to be offering no cost continuous education credits for nurses. We struggled during this year in recruiting nurses, and we learned that we're not offering a good incentive for them. So if you're interested to learn more, just let us know. This is a no cost, and you can benefit from all these no cost continuous education. Those are our strategies. In terms of wins and achievement, of course, all these were wins and achievements, but I want to mention that we have seen a consistent growth in our membership. We meet every month, and we have seen for the past months, or maybe through the whole 2021, that every single month we're welcoming 1 or 2 new members to our HPV work group. So that's telling us that there's great momentum and engagement of people who want to work on this topic of HPV vaccination and cancer prevention overall. Connected to that, I want to mention that we're continuing growing the dental HPV subgroup. They're very engaged, and at the same time, we have a better connection with the Western PA HPV Task Force, who has been also instrumental delivering training and resources to primary care clinics in the western part of the state. So I think the main win for us is that there's momentum, there's engagement. I see more people engaged in this topic, and please join our work group if you want to learn more about what we're doing. In terms of barriers and challenges, I want to mention two, and these are connected with this issue of COVID-19, the pandemic. I think good news is that past month, that we have approval from FDA, CDC, and ACIP for giving COVID-19 vaccination for kids ages 5 to 11. But pediatricians and providers overall, they have been urged to promote COVID-19 vaccine to these kids, and these are this overlapping the recommended age for HPV vaccination. So we have been learning from our members and clinicians that we interact that this is competing with their ability to promote HPV vaccination, and also some parents are concerned about potential side effects of co-administrations of both vaccines, and I think we're still learning a lot about what is the best way to communicate that both vaccines or any vaccine that kids need at this time are safe to receive at the same time, and at the same time connected with that, we're learning from our members that providers are very busy this time of the year with sick visits and mental health visits. So how we can just reintroduce the importance of vaccines, you know, that we make sure that providers use these opportunities to promote vaccines, and HPV vaccination at every visit is so important. We know that providers are used to promote vaccines in wellness visit, but how they can feel comfortable or empowered to use sick visits or these mental health visits to approach parents with HPV vaccination. Connected with that, we have seen nationwide data about low purchasing orders for HPV vaccination, and we know that compared to 2019, 2020, and 2021, we're down with over 1 million HPV vaccine doses across the U.S. So we know we're seeing a decrease in vaccine uptake. So those are our challenges. I think we will get some more information about how we can improve the communication and be more consistent in terms of making parents comfortable about getting multiple vaccine at once, especially HPV vaccine, and at the same time for providers, how we can improve their communication skills on this topic. So those are our challenges at this point. I don't know if Pam, if I'm missing something that you would like to add. If not, I'm open for Q&As.
William, this is just great. I just wanted to mention that the Pennsylvania Immunization Coalition is working with PAAAP, and we've been awarded a large amount of money to be distributed to increase vaccine rates. And we put out, it's over the next 3 years, and we actually put out a request for proposals from the local coalitions. And we are funding I can't really remember the exact number, but quite a few across the state. So there'll be additional work being done across the state in order to increase vaccine efforts in general.
Great.
Any questions, comments for William? This was great. A lot of good work. Thank you. We'll move on then. So it's lung health next, please.
Hi, Lynn. Thank you. This is Denise Walker. Hi, I co-chair with Chelsea Hildebrand on the Lung Health Work Group. So I'll get started on our ongoing. We have 3 ongoing strategies. Strategy 1 is where we've been planning with the regional tobacco cessation providers to begin discussions with the radon training to introduce the discussion for testing your home for radon when they're conversing with the public about smoking cessation. Strategy 2 is our year-round radon awareness campaign or attempt to move from real estate driven to cancer concern driven options. We want to increase the media attention not only during the National Radon Action Month, but to year-round. And strategy 3 is our identify and promote lung cancer screening education activities, resources, and tools to smoking cessation providers and lung health stakeholders throughout Pennsylvania. Our newest, in line with strategy 3, there has been a new course that was released this year. And I think Isabel kind of touched on that a bit. And if you remember from the June 2021, Ron Myers presented at that quarterly CAB meeting concerning the white paper done on lung cancer screening. There is a free online training program that is titled Shared Decision Making in Lung Cancer Screening that was developed by the American College of Chest Physicians and Thomas Jefferson University. That is to help identify and educate eligible persons for annual lung cancer screening. The course takes about an hour, and you do receive continuing ed credits for that. They're available upon completion. Most recently, on November 16th, Dialogue for Health held a webinar, and Ron shared this training at that webinar. There were about 150 attendees present. And he did also share with me a notable outcome was that there was a major health system in Pennsylvania. They've expressed interest in making the shared decision-making training program available to providers across the system. And we can share the link. Oh, and I think Brenda just did that. Thank you. Shared the link for the training. Moving on with some more achievements. DEP, we just recently completed our radon poster contest. That was held this fall, and we have more participation this year, which we were happy to see. We probably had over 100 entries submitted. So we did select a winner, and then that winner gets sent on to the national contest. And then in January, the national winner, and then we'll announce the Pennsylvania winner as well. And that poster contest, the winning poster usually gets used in some of the social media and some of the PSA stuff that'll go on throughout January. DEP is also working with the American Lung Association on our targeted survey mailings. And those, we target areas that have tested over 100 picocuries per liter, and we select their municipalities. We give them the option of sending a letter to their residents and offering a free radon test kit to them. And currently we have had, we're in the process right now. We started the mailings the end of October, and every week a letter will go out to a different municipality, and those go out through the end of January. We will have mailed out over 40,000 letters with an offer to a resident to get a radon test kit. Another achievement, Jackie Nixon with the Citizens for Radioactive Radon Reduction, their magazine for the month of November was released. And their organization also has Radon Hero, Radon Rival calendar and t-shirts available. Those are some themed products that you can purchase if you're interested in that. And this is an ongoing, I think Isabel touched on this. The YMCA has been doing a penny tour across the state. They are more than halfway through their tour, and they've been able to distribute radon kits and education to individuals with these events. They've toured more than 30 counties, and they've distributed probably over 500 test kits and literature. And in DEP, we are tracking the return of those test kits. So that'll be a couple of months or probably even up to a year till we have some results from that. The American Lung Association has a couple activities that have happened recently. They had a lung cancer patient forum, was October 21st. That was an hour-long virtual event where the lung cancer patients and caregivers had the ability to ask questions to expert panelists, and these panelists were physicians and professors from UPMC, Fox Chase Cancer Center at Temple, and Thomas Jefferson University physicians and professors. And they also have upcoming Lung Force Expo that's scheduled for December 8th. Again, it's going to be virtual. It's designed to help healthcare professionals learn about the latest trends in research, treatments, and recommendations for lung cancer. And there are continuing ed credits available for respiratory therapists, nurses, and certified health education specialists. And wrapping up here, we do have 2 requests for the group. If you could assist with disseminating the lung cancer screening tool that was developed by Ron and his team. And again, the link for the training is in the chat. And also, with January being National Radon Action Month, help spread the word. DEP has a social media campaign that will be ongoing throughout the month. And if you happen to come across any of those postings, please just share it. It's simple. Just, hit a button and share it with your family and friends. Test your home for radon. That's it. If I have any questions. I see some.
You can't even hear me. I'm sorry, I was muted. There don't seem to be any questions. Just a lot of thank you.
Okay, very good.
All righty. So moving right along, I think I'm up next with colorectal cancer screening. And in reporting out, we are currently working in collaboration with the policy subcommittee working on, and this is going to take time. It's not going to happen overnight, but we're trying to get word out there to our various members and across the state regarding the need to close the loophole of cost sharing when a follow-up colonoscopy is required. So in other words, when individuals do stool testing, it comes back positive, then the next step is colonoscopy. Depending upon your coverage, some individuals are then being billed for this procedure as diagnostic, and then there are out-of-pocket expenses. And those out-of-pocket expenses may be small, they may be very large. So we are trying to pull together the various cancer centers in order to work with the policy committee to move this legislation forward so that this cost to the patient does not come across to them, but is covered by the insurance. We're also working on an employee business initiative with the Department of Health, and April's taken the lead on that. And again, we're not, the anticipated timeline with a website deadline is potentially December tentatively, but we're still working in that direction. So we'll give more updates as we continue to move forward in regards to that. In addition, moving forward. Oh, I'm sorry, April, go ahead.
I'm sorry. I just wanted to, so one of the things that we have identified, not just for colorectal, but for across the board, is working with businesses and employers. And as our partners, that's important. So we have a goal of developing a business and employer website as part of PACancerCoalition.org. There's a transition going on, and I know Monica is working on that project. So this is just part 2 of the project of getting a draft workplace policy in place. So our partners, including the coalition, have a place to utilize something that has been reviewed and implemented at other providers, employers, and businesses within your areas. I'm done.
Okay, thanks, April. April and I have been co-chairing the CRC work group. So it's, with our other hats, it's been kind of a little bit hectic. But in addition to that, in April, on April 21st and 22nd, American Cancer Society, in collaboration with the Department of Health Community Health Centers Collaborative, will be doing training focusing, but not restricted to, colon cancer screening. They will be talking about preventative screening and early detection. So this will be coming forward in 2022. Some of our needs are, yes, it was great to see this slide and see that we've met our goal with colorectal cancer screening, but we know that there still are many individuals out there that need to be screened. May be unaware, maybe in areas where they're underserved. There may not be enough providers, or they may not have primary care providers, or they may not have funding to get screened. So again, we need to do a lot more work. So we are in need for the colorectal cancer work group for an additional co-chair so that April can return to all her duties in the Department of Health, even though I've been very grateful that she's been able to assist. The other thing we would like is at our last meeting in November, we had 10 members. We have a rather large roster, and we had sent out a survey monkey to determine when the best time to meet was, which was at 12 noon, if I'm not mistaken, on a Thursday. We potentially will send out another survey monkey to see if the timing is incorrect, because there was a time last year where we were meeting very early in the morning, and maybe that's better. But we do need more participation, and we, again, have a large roster, but we need to know when people can meet so that we have more individuals involved. Aside from that, that's the end of my report. Are there any questions, comments? If you are interested in joining the CRC, please notify myself, Lynn Robertson, or April Barry. Thank you very much. Next report. Okay, Men's Health.
Okay, good morning, everyone. This is Fern Gilkerson. Brian Jones and I, co-chairs, are going to split our report this morning. So basically, this is a progress report. The Men's Health Work Group is continuing to meet monthly. We have a really robust group who contributes regularly, and we've added a couple of members. Actually, folks on this call, Monica Fisher and Carla Ann Henry, thank you both. Brian Jones, Armento Washington, and I spoke to the community health worker class at Temple University, Harrisburg in September. Brian spoke on prostate cancer, Armento spoke on colorectal cancer, and I spoke on how CHWs can do community provider engagement to promote cancer screening. We're also working on an online learning module on promoting cancer screening, and it is a work in progress. A version has been drafted that we'll continue to work with. And we're currently tying in just sensibilities and information we continue to get from Polly Hoppin over at the Cancer and Environment Network of Southwest PA. She keeps us informed through her great emails and the wonderful webinar they recently held. And Brian, I'll hand it over to you, and then we can maybe have folks ask any questions that you might have.
All right. Excuse me. Sounds good, Fern. Thanks, everybody. Brian Jones, Men's Health Co-Work Group Co-Chair here. One of the things that we've been working on is, in our work group as a team, developing a family medical tree, which focuses on comorbidities and cancer, so that we have like a list, a sheet that we can put out to people that we talk to at conferences or through email, things like that, possibly even a website where they can print this off and have a family tabletop discussion and talk about comorbidities that run in the family from different relatives, and then bring that all together to find out what runs in their family, identify it, and then have that addressed through their doctors. So a way of prevention. Also, the Men's Health Work Group has a working calendar of events that dates back to when Fern and I started, took over as co-chairs of the Men's Health Work Group. And I'd like to recognize Carla Ann Henry for all of these colorectal cancer events that she attends and is getting the word out in my hometown of Philadelphia. Carla Ann even has an event scheduled for this Saturday in which I will be out in the community attending an event at Christian Stronghold Church in West Philadelphia. Also, I've been working with, we have rather been working with a primary care physician at Penn State Hershey, who's very interested in men's health screening, detection, disparities, things like that. So getting data from him, talking to him, best practices, and he's been helping us out a lot. Speaking of Penn State, we attended the Penn State Cancer Conference on the first Saturday in November. That went well, a lot of information, a lot of different doctors speaking about cancer in the community, what can be done, breaking through barriers. Next, the Pennsylvania Prostate Cancer Coalition is having our annual conference. It will be held in Malvern, Pennsylvania on April 2nd. So anybody interested in coming to that, please reach out through the website and let us know. And then last thing that I'll cover is we have a college campus outreach initiative that we're looking to kick off in the first quarter of 2022. It'll be a pilot program that we're looking to roll out at Shippensburg University, where a couple members of the Men's Health Work Group will have a discussion at Shippensburg University's campus in their Minority Affairs Division, which is where I attended school at. So we'll be talking to students there about health, and what's really driving that is cancer diagnosis, and also information that was received by the doctor at Penn State Hershey, where it shows that people entering the workforce that are aged between 20 and 30 have a less propensity to have a primary care physician. And as the age group tends to go up higher in age, the propensity increases. So our goal is to attack that head on with college students and making them aware of it. So that's one of the goals that we have We almost have a date. As soon as we have a date, we will let you know about that. And just thankful for the members that are in our group. Thank you for Fern and everyone else. It's a blessing to be able to work together as a team with a bunch of people that are committed to the goal. So if anybody has any questions, you can follow up and let us know. We would be more than happy to work with you.
Thank you very much. Boy, that was a lot of work and very informative. Thank you. Great job. I don't see any questions. So if not, then we'll move on. Cancer Genetics and Genomics presented this morning, so they will not be presenting at this time. So report out for survivorship is next.
Morning, everybody. Can you hear me? It's Stephanie Washburn.
Yes.
All right. Hi. Good to see and hear everybody. I love hearing the updates from all the other work groups as well. So I'm going to represent Amy Jacobs and the rest of our work group with this progress report. So I'll start out with a few quick updates on our priority strategies right now. The first of which connects to the survivorship planning goal of the Pennsylvania Cancer Control Plan, which is to support health systems in the development and implementation of survivorship programs by increasing access to community resources for providers and people living with cancer. And of course, this connects to the Commission on Cancer standards, not all of them, but some of them. So we decided recently, and I think this was mentioned in the last PCC meeting, that we thought it would be helpful to develop and field a short focused survey primarily to people with cancer in Pennsylvania, but perhaps also providers and caregivers, to develop an understanding of what they define as their resource barriers and needs. Especially since COVID, we know there have been some changes in that, significant changes in that. So I want to thank the evaluation subcommittee, who Amy and I have connected with, and they've been really helpful about their willingness to help advise us in the development, the work group in the development of that survey. So we're in very early stages of that at this point, but that'll be a real big priority for us in the coming weeks and months to move forward on that. Since the Genetics and Genomics work group is also developing a survey, like was mentioned earlier, we connected briefly with them, and we will touch base to see if there's any alignment or where there may be alignment in the topics of the survey. Is there any overlap in ways we can think about developing or distributing together, depending on the audiences and the goals? So we will use the results of the evaluation that we put out there to then, identify gaps, hopefully also look at some successes, and then use that information to really drive forward the goals and priorities of this work group even further. We've been really pleased to welcome a number of new members to the work group in recent months. And I won't say everybody by name because it's too many, but a couple people I do want to mention because there's a lot of overlap in the efforts of the work group. One of those people is Veronica Peniatu, who's the Advocacy and Program Manager for the National Coalition for Cancer Survivorship. She'll be joining our next work group meeting, which is, next Wednesday, and is going to present to the work group on the NCCS's State of Survivorship Series 2021. And a number of you might have seen some of this information. I was able to attend a presentation on it, I think in September. But it's research that NCCS conducted to better understand the differences in patient and survivor attitudes, experiences, and needs. So this could provide a really great foundation for the development of the survey and inform other work that our work group is doing. So we feel really fortunate to welcome Veronica to the group and look forward to the additional details that she'll be sharing with us next week. Another one of our priorities is to collaborate with patient navigation programs to address barriers to access to care and resources commonly experienced by people with cancer. And so through the PCC, we were connected with Kate Conkle, who has since joined the Quality of Life and Survivorship Work Group. She presented to the group, I think at our last meeting in October, about the work of CanSun. And Kate, I'm sorry, is the lead health educator and navigator coordinator for the Cancer for Penn State Cancer Institute's Cancer Navigation and Survivorship Network, or CANSUN. I know many people are really familiar with all of that. So we learned more about what CANSUN is doing right now and have talked with Kate about ways that our groups can collaborate to further the work of both groups. So very excited to continue to work with Kate as well as other navigation programs moving forward. Another of our priorities is to provide physical activity programming to Pennsylvanians aged 18 plus and living with or beyond a cancer diagnosis to reach at least the recommended 150 minutes per week of moderate intensity physical activity by 2023. So we're really fortunate, of course, to work with Live Strong at the YMCA. Amy Jacobs, our other co-chair, works there, as well as some of the other members of the PCC, as many of you know. And Live Strong is right now finishing up a virtual physical activity session from this fall. And in January, we'll also be kicking off both in-person and virtual class sessions. So we will have some data to share about those in future PCC meetings. So something that we are planning to do at our work group meeting next week is Amy and I have developed a really short survey for our membership so that we can identify where the members are most interested in focusing their time within the work group strategies. We have an incredible group of members who bring a lot of energy and a lot of talent. We have a lot of things we'd like to accomplish through the work group. So we're going to take advantage of some of that time together next week to increase our understanding of where people, again, have the most interest. And so we'll be looking at, under the strategy of supporting health systems in developing and implementing survivorship programs and looking at community resources. We're going to see which of our work group members are most interested in focusing on the survey development and distribution, who would like to focus some energy in learning more about community resource databases as a means of distributing and disseminating information for people with cancer. And then also develop a strategy or systematic strategy for gathering quality of life and survivorship related resources from work group members and others to add to the PCC survivorship webpage. So we've observed that page could benefit from some updates with information and making sure that the resources that member organizations and others, people from PCC and beyond, are available to providers and consumers through that page. We're also interested in gathering information about other national or Pennsylvania physical activity programs in addition to Live Strong at the YMCA that people in Pennsylvania could participate in. Learning more about additional navigation programs and coalitions in Pennsylvania and beyond to help inform our work. And then we continue to work to identify and reach out to potential new members to fill areas of expertise that will help advance our goals. So that's kind of the where we are right now. One question that I do have, and I am guessing the answer to my question is Monica, but if Monica or somebody else from the PCC or DOH could weigh in, when we have identified resources to be added to the PCC survivorship page, Monica, do we send those to you? And if not, could somebody please just remind me of the best way to do that? And if there's a particular form or format we would use? And my apologies for not remembering that from previous discussions.
No, that's okay. People can send it to me, but we have the RA box now, which allows me to put things in there. And if people just put in the subject, request to post to PCC.
Okay.
Monica, could you drop that email
that
in the
was-
link in the chat, please?
That's gonna be my next step. So give me a moment. Are we going to, I'm gonna have to put the.
No, Monica, go ahead and do what you need to do because there's a question Brian has. He's on
Okay,
the phone.
gotcha. Thank you.
Yes, good morning. I just had a question for this survivorship group. I wanted to see if there's any plans to incorporate services that you're rendering to the community, also to the Uptown Harrisburg YMCA community. I know the director up there, he's from the community, and reached out and talked to him, and he's interested in also bringing resources in and making sure that that community, which is primarily underserved and is going through gentrification right now, can that community be included in what's going on in survivorship through the YMCA, because that's a vital part of the community. Just for an example, there have been people who have come out of that YMCA who are actual players in the NFL and various other lawyers, doctors, things like that. So I wanted to see if they can look at that while their grandparents and other relatives are suffering with cancer to still live in the community. So I wanted to see if that could be looked at and possibly addressed.
Brian, yeah, thank you so much for raising this. And I'm sorry that I'm having a little bit of difficulty understanding. I think there's just on my end a little bit of lack of clarity of the connection. I didn't get the full detail of what you shared, but I would love to hear more about, if I'm right, you said a resource in the Harrisburg area and that you've got a contact or colleague who's interested in making sure that information is available to that community. Do I have that at least partially right?
Yes, it's partially right. I can clarify it for you. What I'm interested in, and I've talked to the director of the Uptown Harrisburg YMCA, and they're looking at survivorship programs, not just being at the downtown Harrisburg Y, which is like their primary focal point of Harrisburg. They need to also look at the Uptown Harrisburg Community YMCA, where a lot of our underserved community resides at. So, and not having resources in that community will provide some type of transportation so that if you want to rotate it around and have one time you're having it at the Harrisburg Y downtown and then the other time at the Uptown Y, I think we're missing out on a great opportunity to serve the community more and get the PCC's name out there by providing resources to our folks in that community.
Great. Thanks, Brian, so much for clarifying that further, because I was able to hear better this time. So yes, I would love to talk with you some more about that. And I'm sure that Amy Jacobs would agree. So I've made a note to maybe to reconnect with you offline, and maybe we can set up time for a call later this month to learn a little bit more and discuss some ideas. Would that work for you?
Yes, ma'am.
All right, terrific.
That would make my day.
Steph, just so you're aware, Brian, anyone in the entire service area of Dauphin, Perry, and Cumberland County and beyond, outside of those counties, can participate in the Livestrong program, regardless of, we'll help with transportation needs, anything like that. So it's not necessarily that the focus is downtown. We actually have our new branch out in the Friendship Center area off Jonestown Road. And I believe you're speaking of the Camp Curtin branch. So everyone that is a survivor would qualify for that program, and we'll make sure that they have a way to access it, especially with our virtual component, if they feel like they would rather stay in home. So there are ways for that to be addressed, but I would love to set up another meeting and we can discuss that, like Stephanie said, outside of this meeting here today. But thank you so much for bringing that up and expressing your concern.
Okay, look forward to hearing from you.
Thank you.
Great. Thanks, Brian. We'll definitely be in touch. And Amy, I'm glad that you're here, and I'm so happy you were able to jump on and share a little bit more. While you're here, Amy, was there anything else you wanted to add about Livestrong or any other topics that I talked about?
I don't believe so, Steph. I think you did a good job. I really do want to express, we are a huge supporter of trying to get all of the different physical activity programs that are offered throughout the state, because there's no reason that someone can't participate in multiple programs, and it just basically could be kind of like a flow through one program to the next. So I think setting up those connections and the resources that are needed are going to be vital, and that's what we hope to do by getting all this information with this survey completed.
Yeah, and actually, Eugene just put in the chat, I don't know, and I copied this down, I don't know if you could see it, Amy, but information about a Penn State extension program called LIFT, Lifelong Improvements Through Fitness Together. So this is awesome, and thank you very much for sharing that. And I'll put my email address in the chat, so if anybody else has additional resources that they want to pass along related to any elements of survivorship, I know that's broad, then please feel free to do that. And if there's any other questions, please feel free to shout those out or put them in the chat. And otherwise, thank you everybody for your time. And again, a special thank you to all of our great work group members for everything that they contribute.
Thank you so much, Stephanie. Great presentation. And everyone, please be aware of what's going on in the chat, because Monica's putting a lot of information in there as well as others. So I think it's important that you at least view it, because it may be helpful to you in the future or may answer some questions. Monica, if you're ready, we could go to the next slide, please. Okay. Okay, now we're going to move on to subcommittees. I don't know if there's necessarily anything to report for various subcommittees, but I'm going to at least go through them. So disparities, I know I did hear from you, and we're going to have a report out. So you're up next.
Hello, everyone. This is Sharnita Ziegler-Johnson reporting for the Disparities Subcommittee. The role of the Disparities Subcommittee is to provide an overarching support to the Cancer Coalition and all of our subcommittees and work groups in your activities and your requests involving health disparities and health equity. One of the things that we want to do is to help identify populations that need greater attention and areas of the state where we need more focus. And we can also suggest evidence-based research and programs that can be implemented in your work. Evelyn Gonzalez and I, as co-chairs, are members of the Policy Subcommittee, Evaluation Subcommittee, Data Advisory Committee, just to make sure that we are engaging with those critical parts of our Cancer Coalition and Cancer Plan. We also try to keep Disparities Subcommittee members abreast of new happenings. And our team is supported by Monica Fisher, and we're so excited about the energy and insight that she and all of our members bring to our meetings. We have a current project, which I think you heard a little bit about last time, the Men's Health Project, where we are focusing on the health and well-being of Black African-American men in our state. This was a project started under Sharon Sowers, and we were able to provide her with some advice on what should be included. The project was recently completed by Monica Fisher, which is just a document which summarizes the various health concerns of Black men in Pennsylvania, especially focusing on where we have racial disparities. So the document, which is online, now covers cardiovascular disease, cancer, diabetes, obesity, smoking, infectious disease, etc. So we have access to that document, which is wonderfully done. I hope you get a chance to take a look at it. And also we have access now to the Pennsylvania Department of Health Chronic Disease Report. And we will be using those documents to kind of guide the work that we're doing related to cancer among men of African descent. So we have formed a writing group. We are organized and ready to focus on several cancers with disparities: prostate cancer, colorectal cancer, and lung cancer, where we see the highest incidence in mortality among all men in Pennsylvania, but particularly among Black men. And also bladder cancer and liver cancer, where there are also some differences in cancer rates and or the stage of diagnosis by race. The goal of our project is to write a 1 to 2 page document on each cancer, which then can be used to educate policymakers, physicians, scientists, community stakeholders about the work that still needs to be done to reduce these cancer disparities. And we decided to focus on prostate cancer as our first write-up. And I just want to remind my members that the components of that document, whether you have a draft or just some notes, they're due in 2 weeks from December 15th. And you should send those to Evelyn Gonzalez. We will be continually gathering that information. We've already received some from some of our members, and we have gathered the statistics that will support these documents as well. So we're almost ready to compile that first document, and we're hoping that the others will flow very quickly after that with a similar format. There was also some interest in our group about doing some mapping or having maps available to us. We want to be able to combine and display the cancer disparities. What we have available to us right now through the dashboard and through EDDI really is just, we have maps, but they're just presenting one cancer at a time, one race at a time, and we need to bring those things together so we can better understand where the disparities are most commonly happening in our state. And there's also an interest in bringing in some socioeconomic indices. So we'll have to think about how we can do that. We need some additional capacity to do that and time to gather all of those data. We'll also need support from the Data Advisory Committee, which I know is being pulled in lots of other directions right now, as well as other members of the Pennsylvania Department of Health to provide the support we need for that. And we, again, are focusing statewide. So some of us have done some work like this, focusing on just our city or immediate, region. It's a little bit different when we're thinking statewide. So this was big to bring in the maps, but I think the maps would definitely complement some of the work that we are doing. We will also be working very closely with the Men's Health Work Group, Policy Subcommittee, and Lung Health and Colorectal Cancer Work Groups when we are ready to finalize the reports, and also to disseminate the reports to various stakeholders in our state. So if there are any PCC members who would like to get more involved or take the lead on other cancers beyond prostate cancer, which is our first one, you are welcome to join with us. We could use the help. And once we have a draft for prostate cancer, I think the others, as I mentioned, will be pretty easy to format and prepare. So please let us know as well if there are other projects that you are working on that need our support or guidance from any of our disparity subcommittee members. Like other groups, we are a group that is growing by leaps and bounds. We have about 36 members, active members right now. And one of the things that has been a struggle, and it has been since the beginning of the disparity subcommittee, is getting them all involved. I've had a few people reach out to me in the last year, and they have different interests where their interests, certainly complement everything that we're about with Disparity Subcommittee, but they're more interested in outreach and community education. They have those interests and those skills and that experience, but those are yet unmet needs that we really don't have the projects coming to us to really get them involved. So I'd really like for us as a coalition to think about how we can involve these individuals who we have asked to join with us. They may be lay members, they may be community stakeholders, and they just want to be involved in different ways. We'll of course be able to bring them in to help us with the writing and formatting and dissemination of our reports, but I'm sure there are other things that they may be able to contribute to as well. So we don't want to just be a diverse coalition. We want to be much more inclusive and making sure that everybody's voice and experience and all of those things are being utilized to the best of our abilities. So just want to find other ways to keep all of our members engaged in the coalition. So any help with that, or projects that you need, surveys to review, committees that need someone to sit on, please let us know, because we have members who are itching to get involved in some other ways. And I think that's all I have right now. Thank you. Any questions?
Attorney Heather is asking if it would be useful to possibly have a outreach subcommittee.
I was actually thinking that too. We have people with that expertise. We also have survivors now, prostate cancer survivors and loved ones who maybe could provide some additional support to the overall cancer coalition, and definitely can work on some projects that are more of interest to them. So I was thinking the same thing. Something we should consider.
Okay. Any other questions, comments? Great presentation. Lots of good work there again, Charnita. Thank you so much.
Thank you.
Okay. Evaluation. Anything else in regards to that committee?
So I had told Mark that I would cede this time to him because we had already talked. I had already talked a lot. Mark, did you have anything that you wanted to mention at this time?
Yeah, let me give you a breather. That was a great presentation today. I think we could all agree. I just wanted to, again, recognize Heather Isabel Connor from the PHMC and also April from DOH Support for their, really for their outstanding effort on pulling that together and continuing to contribute and provide structure around the evaluation subcommittee. I think the insights that we overviewed today are just phenomenal, and I'm really convinced that we're going to use that to really transform what we're doing in this coalition. It's just really the tip of the iceberg on what we were able to share today from all the data that's been collected through member feedback. So I think we still have a long ways to go, but this gives us phenomenal tools to make positive changes. I'm happy to share that since our last time together, we've seen growth in our membership as well in the evaluation subcommittee. Of course, a range of expertise and experience is just so valuable to how we interpret the results and kind of give ourselves a frame of context into how we present it and how we can support all the activities. So our subcommittee continues to meet on a monthly basis. We're going to be kicking off our 2022 at the end of January. The focus for the next year for the subcommittee is really to continue to provide meaningful insights for all of you, as well as co-chairs that will help steer future directions. And I think that the focus being on continue to have make meaningful use of the satisfaction feedback, prepare for what we want to collect and have for our next iteration of that feedback satisfaction survey, and also continue to build on improvements for the cancer plan goals report card and providing that feedback. So there's been some new developments with the evaluation subcommittee beyond just those two main focus areas, and that we're also finding alignment with some of the work groups as well and some of their efforts to conduct evaluation within their own efforts. So designing surveys or their intent to collect some data. So we have, we're bringing the evaluation subcommittee, asking those work group members to join in our discussions, and we can have, share ideas and provide feedback on avenues for doing that. So I think that I just wanted to extend that out to all the members in the work groups as they think about, their, how they're moving forward and how the evaluation subcommittee members, may be able to provide, some guidance and feedback to efforts that you're doing. I think that's important. So there's always so much great work happening within the coalition. And I think our evaluation group has really been a resource to work on the coalition. So we're excited about 2022 and optimistic about, supporting a lot of the activities going forward. So thank you.
Thank you for sharing that, Mark. Jackie Nixon has a comment that the CR3 News Magazine is looking for folks to participate in the content team. And the goal is to broaden our worldwide publications information and bridge the gaps between environmental and cancer issues. So if you are interested, she did put the contact information within the chat room. So please refer to that if you are interested. Are there any more comments or disparities at this point? If not, then we'll move on to policy.
Hi, everyone. Emma Watson with the Policy Subcommittee and my counterpart, Ruth. So we are continuing to work on legislative solutions around prior authorization and step therapy. We've had some excellent engagement from other committees and subgroups, which you've already heard about, coming to us with ideas and presentations to our subcommittee on their policy work. We've had some great content shared around legislative efforts on radon on in schools, efforts around increasing HPV vaccinations, and exploring the potential for legislation that would increase colorectal cancer screenings. Another area that we are looking at possibly doing some legislative education around in the new year is biomarker testing. So if you work in that space or that is an area of interest, please reach out and let me know. I would love to connect and discuss further. I don't know that we have any specific needs at this point in time, but if you're interested in being a part of any of these policy initiatives, can certainly connect you with the people in the subgroup working on them. Also, if you have policy ideas, please let us know. We would be happy to create a space for you to discuss them with the group. And as always, if you're interested in joining us, we too are growing. We have over 30 members now. We meet the first Thursday of every month from 9:30 to 10, and we would love to have you. And I think that's it for me. Thanks so much.
Any comments, questions for Emily? Thank you. I think that kind of ends the report outs. We have some time. If there's any other conversation or any other comments or anything we'd like to discuss as a group, I think Casey and I and others would be very interested in knowing if this format works best for the PCC, providing report outs as opposed to having time to meet with your group, since most groups are meeting monthly or every other month and working on different projects, etc. If this isn't acceptable, then we need to hear back, because we want to make sure that we're keeping everybody happy and we're providing the venue where the work can be done. But I think it's also real important that we share with each other so that people can learn other groups' needs and where maybe there can be collaboration, as Mark was talking about with the evaluation work group. Any comments?
My only comment, Lynn, would be to throw out an idea around kind of what you were saying, if maybe twice a year there were report outs and twice a year there could possibly be time for the groups to meet. That way, still providing an opportunity to share and hear as opposed to seeing it in writing, which not everyone might always spend their time reading all of the details in the notes. Just a thought.
No, it's a good thought. Can we hear from others? I mean, I know in the past we heard that when we did have the time to work as a group, that the groups were already doing that. And, you know, it was like, this is just more time. But we can go either way. So, but we need to hear from you. So you may need to give it some thought, but if you could get back to myself, Casey, or Becky, so that we know for the next meeting that we're moving in the direction you'd like. Okay. Anything else that we need to discuss, Becky?
No, just a reminder, the next CAB PCC meeting, I believe, is scheduled for March 24th. But look in the weekly updates that are sent out every Friday for the specific date. But I want to thank everyone. I do find these meetings very helpful to hear what each of the work groups are doing and hearing about their needs. And then it does give other members opportunity to say, hey, I can talk to you about that. Here's some suggestions or ideas. So, but yes, let us know if this is working, shorter or longer time periods. We're trying to accommodate everyone's time. So I just want to thank everyone for being on. It's been great.
Becky, this is Lisa Davis.
Yeah.
I was wondering if I could just take 2 seconds here. Sure. So I'm Lisa Davis. I'm with the Pennsylvania Office of Rural Health. And Becky and I have, for the last 2 years, been working with a group across the state called Partners by Nature. And what made me think of wanting to bring this up is one of the comments that was posted in the chat about the connection between environmental health and cancer. And what we are working to create is a community within the state that is looking at that connection between health and the environment. And I know that Becky sends all this information out to everybody here, but we are trying to, beginning in January, we want to convene some groups across the state that will be focused on environmental issues as well as specific health issues and public health in general. So we invite all of you to participate if you have time to do so.
Lisa, this is Lynn. I'm very active, and others may be too, with Southwest PA Cancer and the Environment. We have been working for about 2 years, and we have a lot of grassroots organizations in Southwestern PA as a part of us. We have various work groups, etc. In fact, it may be a good idea that we even present at some point here, so could learn more about it and see how we can expand further.
That would be fantastic. Our sort of kickoff of all of this is on January 11th. And I know that Becky is such a rock star in getting information out. So I'm sure that all of you will see that. And Lynn, we would be delighted to have you participate. We did have someone from Pittsburgh who was participating, and then her position changed. And so we've lost that connection specifically to Southwestern Pennsylvania.
Well, we are very interested in expanding across the state. So,
and this is Karen Gilkerson. The Men's Health Work Group is also working on a very compatible initiative, so I'd love to collaborate.
Great. Yay. All right, Becky, so we have to remember this for our call tomorrow.
Oh, absolutely. I just posted things in the chat. I think this is a fantastic idea. Yeah, I think there's a lot of opportunities for more collaboration. So thanks for mentioning it, Lisa. I really appreciate it.
Oh, sure. And thank you.
So Lisa, we are so glad you attended today. See?
Right. I actually said something at one point. Yeah. Yeah.
I would like
seconds of fame.
I'd just like to take the opportunity to thank everyone also, but also to thank Monica, because Monica does a tremendous job behind the scenes and she really keeps it all together. And now she's in charge of slides and she has to deal with all of that. And then all our requests as we move forward throughout the presentations, etc. So Monica, a big thank you goes out to you from all of us.
Thank you to all of you. Thank you to all of you. And I really love the report outs. As somebody relatively new, and I think the impact of starting during the pandemic was great. It's really, really good for me. There were some things I heard today that I had never heard before. And so that gave me some ideas that when I go back with Brenda and Becky, some things that I have to put forward with them to say, you know, maybe this needs to look different, or what do you think? Because I heard a lot of fantastic stuff that I just simply didn't really know. So I hope to perform that task much better, get much more communication out and that sort of thing. But even if it's not in the weekly or you have something, you could email me directly. The resource account is to try to keep everything together, but don't hesitate. If you need to contact me, go ahead and contact me.
Thank you very much, Monica. If there's nothing else to discuss, well, Casey, do you have anything else you want to talk about?
No, that's all. It's a great meeting.
Okay, then we'll give people back about 12 minutes, 13 minutes to their morning.
Thanks, everyone.
So much.
Thank you.
Bye-bye.
Happy holidays, everyone. Take care.